the notion of continuing to get COVID-19 vaccines before they head off to college in your case. But we've got a lot of parents of younger kids who are going to have to decide what to do. The American Academy of Pediatrics is urging shots for children as young as 6 months, but that's a break with the Centers for Disease Control and the Health Secretary, Robert Kennedy. They're pulling back from recommendations for healthy children. Pediatricians, they say youngest children face the highest risk of severe COVID. So they believe they should get those vaccines. The White House is saying the group is undermining public trust when they talk about the Academy of Pediatrics.
Yeah.
Guys,
The question is, who is actually undermining public trust? Because you have this break between the CDC and this pediatrics association. It's confusing for parents. I'm sorry, Allison.
That's my point, Dr. Jeff. That is exactly how anxiety producing it is for parents. Generally speaking, when government works best, they speak with one voice so that you have a consistent message. You can still exercise free will if you want. However, you have a consistent message about what age your kid is supposed to be vaccinated, why, how much it lowers your risk, if it does, all of that stuff. And so the idea that these different government agencies, whether they're federal or local, are giving parents all of this disparate information is not going to help parents figure it out. So, Dr. Jeff, I mean, who are parents supposed to listen to at this point?
Well, I would think at this point that they really have to go directly to the source, and that is to talk to your pediatrician. What does your pediatrician recommend? One would hope that they have taken the Hippocratic Oath. They're not going to get into the politics of it. They're not going to put their personal opinions about it or political opinions about this, that their fiduciary duty is to your child, to the patient, and to make sure to give the best information. And I would think, of course, you want to do as much research as possible. But Allison, you're absolutely correct. This is really a conundrum for a lot of parents that I've talked to. My wife, by the way, is a physician. And one of the things that we don't think about is if we have unvaccinated children coming in, it puts them, of course, more at risk if they happen to actually get COVID. And it also contributes to more vaccine hesitancy in general. So that is a very big issue, too.
And it puts doctors in a really tough position, too, for them to have to sort of go against the CDC. But your doctor, your pediatrician, also knows your particular child's medical history.
That's right.
Right, Allison? They know if you have a pre-existing medical condition, which can be a factor in deciding whether to go ahead and get the vaccine.
So many of us just haven't thought about COVID-19 for a long time. I mean, we were happy to put it to bed once the global pandemic simmered down. We were happy to put it to bed. My kids, as you say, Jim, who are going off to college, haven't thought about it. So I don't even know what the advice is right now for boosters, or when the last time you got a booster, if you're still feeling as though it's effective. And it sounds like, Dr. Jeff, this is for younger kids who are going back to school. But again,
That's right. That's right.
I mean, I find all of this really confusing and really unpleasant to have to think about again after we thought that we were in the clear.
Yeah. And of course, the other advice is, and this is where everyone does agree, those people who are 65 or older or who are at risk for other diseases because of their immune system not functioning well should actually get the COVID vaccine. But again, talk to your doctor.
Yeah, and that's our question of the day. Should vaccines be mandatory? Always, never, sometimes. Right now, always is leading in this question of the day. But you can weigh in by scanning that QR code right there on the right side of your screen and let us know what you think. And we will continue to let you know those results.
It looks like
All
the
right.
results were just updated there in real time. So it seems like it's a fluid question that people feel strongly about.